Welcome to the session on consumer behavior in hospital. It is very important to understand what are the rights and responsibilities of the consumer, not only in the market but also in the health sector. As we know, the health services are also provided by public, that is government sector, and the private sector. And there are certain rights which are being given to the patients and their relatives so that they avail the safe services, they are transparent, and patient and the family is aware about the cost and the other consequences of the health conditions also, and the documents are available to them even for the second opinion. First of all, let us try to understand what is consumer behavior in general and what are the rights. Then we will go in detail about the rights of the patient in the hospital. As we know, the World Consumer Right Day is celebrated all over the world on 15th March every year to raise the global awareness about consumer rights and the needs. It is a day which provides an opportunity to promote the rights of the consumer, demanding those rights are being respected and protected by the people and the government and the various bodies. It also gives people the chance to protect against injustice if there is any. Consumer Empowerment Week, which is celebrated between 14th to 20th March by Department of Consumer Affairs and Public Distribution in our country. And this year's theme of World Consumer Right Day is Fair Digital Finance. Let us see now what do you mean by consumer behavior. All of us are consumer, and when we go to the market, we see what is the quality of the product, from where to buy, when is it reasonable to buy, what is the cost, and various other factors. We evaluate the product, we evaluate the, you can say, whatever we have to buy and from where we have to buy. So consumer behavior definition is, it is the behavior that consumer display in searching for purchasing, using, evaluating, disposing of the product and services that they expect will satisfy their needs. That means consumer buying behavior is an important aspect of overall consumer behavior. As you know, nowadays the media, the way they try to attract the consumer so that the consumer go to them and buy a particular product in this competitive market. So the buying behavior of the consumer, that is being actually targeted by all the parties. It is a tool that market actually understand what is the actual behavior, buying behavior of the people, why, how, when, and how often they buy it so that they can consume and dispose of. There are certain rights of the consumer. Right to safety. Right to safety means protection against marketing of goods and services which are hazardous to life and property. Before purchasing, consumer should insist on the quality. When we also go to the market, we try to see what is the quality of the product, and consumer needs to be informed, that is right to be informed about the quality, quantity, purity, standard and price of the good. Whenever we go to the market, we see the label for all these things. What is the cost? What are the constituents? When it was manufactured? What is the expiry date? So many other things. That's why right to inform is very essential. Right to choose. In this competitive market, consumer has so many options. So they have the right to choose, because right to be assured of access of variety of goods and services at competitive price. In case of any monopoly is there, it is being assured that it is being provided at a right price and the quality is also maintained. Then right to seek redressal. Suppose there is any issue with the product, the consumer has the right to get the justice. They can have the right to complain about it and get the reply back, so that they can get their money back or they can get the right product. About same product, maybe from the same company, it has to be replaced. Right to be heard. If they are sending any complaint, they should be given a chance to be heard about their complaint. It is not that they are sending the complaint and no reply they are being getting, and they are not getting the chance to be heard about it. It's very important. They have full right to be heard by the committee or whatever forum is being as per their state or the district or the national level. Right to consumer education. It is very important to educate the consumer about their rights, about their responsibilities, about their to know about their how to exercise, from where they can get the redressal, and what are the forums where they can file a complaint, what are the addresses, and what is the duration within which they will get a redressal. So, right to education is very important. Declaration of Human Rights. As we know, Universal Declaration of Human Rights, that is right to life, liberty, security of person, right to standard of living, adequate for the health and well-being of oneself and the family, includes the food, clothing, housing, medical care, and right to support during the period of illness, disability and employment. These are human rights which are being declared and they are applicable all over the world. So let us try to understand who is a patient. You must be getting patients in the hospital, and you yourself may be sometimes a patient. Patient is a person who goes to the health organization or health institution for any treatment, during sickness, or for health education, or to avail vaccination, immunization, and there they go and meet the facilitators, that is doctors, nurses, allied health staff, who they provide the services to the sick or to the healthy person. When a patient or family visit the hospital for any medical facility, they are physically and mentally weak. Means they are in a position because they are suffering due to some sickness, and mentally they are not so strong to take decision. That's why we say their position in the hospital is little weak, and the position of the doctors and nurses and the administration is at a higher level. They expect that the health personnel will tell them about their problem, what are the complications, how much time it will take, what is the cost, and many other related factors. So let us see. In India, we have Charter of Clinic Rights and Responsibility, which is given by National Council for Clinical Establishment in 2021. A patient and his or her representative have certain rights with respect to this charter. That means to have a adequate, relevant information about nature and cause of illness, proposed investigations, expected result of treatment, possible complication and expected cost. The information on the rates and charts for each type of service to be provided, and the clinical establishment shall display this at a certain place where people can read all these rates in a local Hindi and English language. You must have seen there is nowadays every hospital have a citizen charter, and boards are displayed as soon as they enter in the OPD, IPD and various other areas, or the services which are provided with the rates are being displayed, so that patient is aware of what all services are provided and what are the rates they have to pay the cost for those investigations. There are hospitals which take some advance, every hospital have their own system of payment. Some take weekly, some take monthly, but patient has to be aware of, because they have to make arrangement for the finance also. Let us see, the adequate and the relevant information is very important for the patient. That is about all the cost, not only initially but over the time. Suppose they have to undergo, what can be the expected higher cost of the treatment, and they should have the access to the copy of the case papers, patient records, investigations and the detailed bill item wise. It's not that consolidated bill to be given. They should have item wise detailed bill. The informed consent is to be taken for a specific treatment. It is a patient's right, but suppose the treatment is being changed. There is some change of, you can say some surgery is to be done, some new procedure is to be done. Again, consent needs to be taken for the patient. And suppose patient has to go for the second opinion, it is very important to share the case record of the patient, all the investigations and the reports, so that patient can go to some other hospital for the second opinion. The confidentiality, dignity, privacy of the patient to be maintained during the treatment. To ensure the presence of female person when investigation or examination of female patient is being done by a male doctor. It is mandatory now, whenever a male doctor is examining the female, it's a right of a female patient that privacy is maintained and there is a relative or a female staff available with the doctor so that she feels comfortable. There is no discrimination of the treatment regarding in case the patient is diagnosed with HIV or any communicable disease also. Everyone is to be treated at par. To choose an alternative treatment, patient has full right to choose even alternative Ayush treatment or traditional treatment in case they want to have for that the same treatment. No one can say to them that treatment is not good or you are not have the right to go to the other doctor, to any other system of medicine. They have the full right in case they have faith in that system. Then release the, suppose patient died in the hospital. It is very important. The patient body should be packed with respect, and it has to be handed over to the relatives with the respect in due time after fulfilling all the requirements. No one can deny the relatives, the family, the body of the patient in case they are not paid the treatment, cost of the treatment. There has to be certain procedure within what time the body is to be handed over as per the policy of the hospital. It is recommended that patients seeking transfer or discharge from the hospital will have the responsibility to pay all the dues of the hospital in due time before they leave the hospital. Before that, that's why we say patient has right to know how much cost will be they have to bear it. Suppose suddenly someone raised the bill of few lakhs of rupees and patient is not aware of, and during discharge from where they will make the arrangement. Therefore, it is very important to tell them approximate cost of the treatment. So it may be patient, it may be specified in the charter that no discrimination in the treatment will be done based on illness, condition, religion, even for the transgender, adolescents, maybe due to geographical areas or the social origin, no discrimination has to be there. And if the hospital is having a digital records, or they will convert the hard copies into digital records, it's very important to inform to the patients and the relatives and to have their consent for that. There are certain additional patients' rights which and the responsibilities as per the National Council of Clinical Establishment and as per the National Human Rights Commission. They are right to care according to prescribed rates wherever relevant, right to choose source for obtaining medicines and tests. No patient is forced to buy medications from hospital pharmacy. He can choose the pharmacy from where he wants to purchase the medicines. Especially if you see in the corporate hospital, they prefer that patient should buy the medicines from their own pharmacy. Whatever medicines or IV fluids or various small equipments and supplies also, but no one can force them. Yes, if patient relatives agree due to easily accessible rather than running out to pharmacy, but they feel the cost is high, or if they feel they can get at a lower cost from outside pharmacy, they have full right to go to the pharmacy and buy these medicines and equipments. Similarly, if the patient wants to get his test done from outside, that may be accepted and facilitated by the hospital or the clinical establishment. This is also a routine wherever patient is admitted. In most of the hospitals, all the tests and investigations are carried out in the same hospital. Again, it is easily available facilities in the same campus. That's why relatives do not have to run here and there. But again, if they feel it is easy to get or at a lower cost, they are able to get from outside. You must have also experienced in some of the hospitals, they do not accept the investigations which are carried out in outside the labs. Maybe due to certain reason, they may feel the readings are not correct or images are not clear. But again, no one can force the patient that they have to get the investigations and tests done in the same hospital. It is a right of a patient and the relatives. So, right to protection and compensation for patient involved in clinical trials as per Drugs and Cosmetic Act and other government guidelines. Right to protection and compensation for participants to be involved in biomedical and health research as per ICMR and other guidelines, and right to patient education. It is very important to understand this. Most of the doctors and nurses carried out research in the same hospital on the patients who are admitted in the hospital. If any clinical trial is being carried out, it has to be clearly explained to them what are the objectives and what are the rights of the patient as a participant of the research group to withdraw from that research anytime. No harm will be done. In case there is any complication during the research, they will get a free treatment and the regular treatment will not be stopped. It's very important to give them the compensation for the time and energy they are spending during that research. And clearly, the risk of the research is to be clearly explained to them in the language what they can understand. In the same way, if as a nursing student or medical student or any student is conducting research, no one can force the patient to be a part of that research. They have full right to withdraw anytime. And it is very important to take informed consent from them. Informed consent means very clearly in the language what they understand. It has to be told about the objectives of the research, how much time will be taken in the research, how much time the researcher will spend with the participant, and what is the risk and the complications. If there is no risk or no complications, then also it has to be explained. What is the benefit of that research, even of clinical trials, to a patient and to the community as a whole? Then what compensation the researcher will give? It has to be clearly explained to the patient and the relative. In case the patient is vulnerable group or is a child, the consent has to be taken from the parents in case of a child who is below 15 years, and if 18 years, then as an adult the child can give the consent. But if the patient is unconscious, is vulnerable, is women who is in labor, who is pregnant women, or elderly people are there, or disabled people are there, it is very important to take, or psychiatric patient, very important to take from their relatives, and in case they recover and they understand, a reconsent has to be taken from them. Then patient education. Very important to educate the patient regarding various aspects of the treatment, cost of the treatment, what is the consequences of the treatment, benefit, risk, and various other factors. The right to be heard and seek redressal. Every hospital will have or establish a time-bound grievance redressal mechanism to address the grievance of the patient. A grievance redressal officer will be identified by the hospital, and the contact details has to be displayed at a place where patients can see that, and the details of their phone number, email, and room number where they are available. I think all the hospitals have a redressal system. It's very important to display at a prominent place, and we have to see it has to be in a local language, Hindi and English, so that patient can understand very clearly the room number, the floor, the phone number, contact details, everything, the timing, availability. Sometimes people do not write at what time the grievance officer will be available. So all these things are very important to display. Then the records of the grievance received has to be maintained by the hospital. Name and contact details of the district registering authority will also be displayed if in case the patient is not happy with the redressal grievance system in the hospital. I think nowadays many hospitals have Rogi Kalyan Samiti also and redressal committee also, and medical superintendent is the chairperson of that committee, or the is a secretary of that committee, and even the people from RWA, NGOs and local people are also involved, so that they can take care of all these factors which are responsible for patient grievances. So very important to know that all these things needs to be displayed at a right place in the hospital. Right to proper referral and transfer, which is free from commercial influence. That means whenever patient is being transferred or referred to any place, there should not be any commercial angle for earning. If one hospital is transferring the patient from other hospital, they should not have that commission of transferring, so that very frequently patients are being transferred. No commercial angle should be there. And it is very important that they should have a provision of ambulance to transfer the patient. And in case anything is to be paid by the patient, it should be clearly told to them that this much amount they have to pay if they want to have the ambulance, avail the ambulance services from the hospital. But that services should be available, and again it should be clearly mentioned somewhere, displayed, what are the ambulance cost or charges as per kilometer or whatever the policy is, and from where, whom they can contact for the ambulance. So these things are very important. These are rights of the patient, because suppose they do not have their own vehicle and ambulance is also not available, the patient may suffer due to these delays of getting the vehicle and being transferred. Then in case of emergency situation, if there is a referral transferred, it should be provided free of cost. No one should refuse that. If they cannot pay, they cannot be transferred during the emergency. State and UT or the government may consider to define these charges for the patient so that it is affordable that patient can avail these services. Clinical establishments will be required to display the rates and charges of ambulance, and referring hospital should provide a qualified trained person to monitor and manage the condition during the transfer. There has to be someone who will accompany the patient in case patient is sick. The vital signs needs to be maintained, or the IV fluid needs to be maintained, oxygen is to be seen on the way. So there has to be one trained person who is with the ambulance and the patient and the relatives. These are some of the rights of the patient. No one can deny the patient these rights. Information about all these things should be disseminated. Studies on the patient rights in India give a limited picture of the situation. There is study done and the survey was carried out that patient-physician communication around HIV testing and identified a number of gaps between practice and guidelines. There was seen that maybe these patients were not able to get a proper care due to various social factors. Physicians in India have always held disappropriate power over the patient. Already I have told you, doctors have a higher position of taking the decision rather than the patient and the relatives in the hospital. What are the patient's responsibilities? Some of the responsibilities: to provide a complete health-related information, cooperate with the doctors during examination and treatment, follow all the instructions of the treatment, pay hospital agreed fees on time, respect and the doctors and the other hospital staff, never resort to violence. But unfortunately, we have seen many cases of violence in the hospital which increased over the time, especially during the COVID. It was seen that patients, if they were not getting medicine, oxygen or the beds, they were beating the doctors and the nurses and the hospital staff. They were not cooperating with them. And statistics have shown that, as you can see, 75% of the doctors across the country have faced at least some form of violence, and that 68.33% of the violence were committed by the patients, attendants or relatives who were escorting the patient. But these numbers are just estimates. There are cases which are never being reported even. And family members, there was a very famous case in the newspaper that family members during COVID, how they have actually they were beating, and there was a violence in the one of the corporate hospitals in Delhi. And that was a situation when government also took action, and our associations, IMA, TNAI came forward to protect our health workers, the doctors and the nurses, because it's not the fault of, we have to understand as a citizen, doctors and nurses are being appointed there. They are there to provide the care. If beds are not available, if medicines are not available, equipment is not working, it is the responsibility of the administration to see that. The hospital staff report to the administration that these things are to be available so that they can provide a quality care. But beating the doctors and nurses is not a solution that they will get a good care. It has actually created a communication gap between the patient and the staff of the hospital. It is the responsibility of doctors and nurses both to have good communication and respect each other rather than creating a violent situation in the hospital. Therefore, in this session, I hope you are able to understand what are the various rights of the patient, getting from the quality of care, reports, medicine, from where to buy, from where to get the test done, and especially about what is the financial burden on the family in advance. It's very important to inform them. And there are certain responsibilities for the patient or for the consumer, that is, they should have full participation in decision making. They should inform about their condition, inform about their medical condition, family history, and they should cooperate during the whole process. And no violence should be there with the doctors and the nurses. If there is anything they want to understand, then they should communicate with the patients and the confidence in the doctors and nurses. Thank you so much.